Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we are announcing 10 additional deaths due to COVID-19. It's a male in his 80s, a female in her 80s, and a female in her 90s from the Winnipeg Health Region linked to the Maples Long-Term Care Home. A male in his 90s from Southern Health, Santé Sud, linked to Bethesda Place. A male in his 90s from the Winnipeg Health Region linked to the outbreak at Victoria Hospital. A male in his 80s from Winnipeg Health Region linked to Seine River Retirement Home Cluster. A male in his 70s from the Winnipeg Health Region. A male in his 80s from Southern Health, Santé Sud, linked to the outbreak at Carmen Memorial Hospital. A male in his 90s from Southern Health, Santé Sud, linked to an outbreak at Brooklyn Terrace. And a male in his 70s from Southern Health, Santé Sud, linked to Bethesda Regional Health Center. And so we'd like to extend our condolences to their families and friends and loved ones. The current 5-day COVID test positivity rate is 13% provincially, 12.8% in Winnipeg. 392 new cases identified as of 9:30 this a.m., bringing our total lab confirmed cases to 11,339. We continue to see a high number of cases. In the last 3 days, we've announced more than 1,000 cases. We can't sustain this number of cases in our healthcare system. We need to bring these numbers down, and we need to work on that starting right now. Our hospitals are near capacity. We have over 40 people in ICU with COVID-19 right now. Our healthcare providers are becoming overwhelmed. I know many Manitobans are worried. Many Manitobans are scared right now. But we do know what to do. We can act right now to keep bringing these numbers down. I know that many Manitobans have done so, but in no clear terms really is to stay home. We need to stay home, socialize only with members of our household, only go out for essential purposes. And we saw examples of that not occurring on the weekend. We saw examples of stores that were open as if there is no such thing as COVID. We saw packed parking lots. We saw crowded stores. We're seeing double digits of death rates, hundreds of cases each day. We can't go on in this manner. If stores were busy and crowded, they weren't following the 25% capacity limit. It's required under the Public Health Act to do so. The orders require them to maintain that physical distancing within their patrons. We've obviously had to allow some businesses stay open. We want Manitobans to have access to critical supplies. Right, so this is groceries, baby formula. Need to be able to repair a leaking faucet. Need to replace an appliance. Food supplies for pets, etc. But we need to maintain those reduced capacity levels. Need to be able to maintain physical distancing within those areas. We don't want Manitobans out shopping for non-essential items. Right? We need Manitobans to stay home right now. Many non-essential items are available online or curbside pickup. Many essential items are available that same way. Right? The message is we need to stay home. Don't look for reasons to go out. Look for reasons to stay home. We all need to step up right now to stop the transmission of this virus. We know that with the public health orders comes enforcement. And moving forward, any of these stores found with exceeding capacity, not maintaining that distance, there will be enforcement going forward. We can't keep this up any longer. We'll also reconsider categories of essential businesses and the rules that govern them. We know of many businesses that have purposely tried to remain open by not following the spirit of the orders, try and find ways to now sell small amounts of what's critical, so in order that they can stay open and continue selling their non-essential items. Right? This hurts Manitobans. Right now, Manitobans need to be staying home, not looking for ways to go out. We receive many requests, many emails from different sectors requesting that they be listed as critical. Many putting forward plans on how they can be safe. But that's not what the message is. The message is we're not looking for ways for Manitobans to go out right now. We're looking for ways for Manitobans to stay home. We're not going to look for ways to add to our critical retailers because we don't want more people going out. We want people to stay home. That's what we need right now. Our hospitals are at a critical juncture. We're not looking to try to find ways for people to be out and about. We need to reduce that. So I know that's difficult on businesses, but it's here for a critical reason. And so we all need to step up moving forward. We know that this virus is spread through close contacts, and we've been messaging since the beginning of the pandemic to reduce the number of contacts. And especially now it's very critical. In fact, right now our contacts should only be really our household members for the most part. Well, a case over the weekend had 85 contacts. Right? We can't manage this pandemic if cases have 85 contacts. And that's what we've been messaging Manitobans. Keep track of your contacts, right? That list should be very small right now. It should be mostly your household. But 85 contacts puts us all at risk. We can't accept that. One of the big tools that public health has is contact tracing. We find a infectious case and then find those contacts. Certainly, hopefully, not 85 of them, but we notify them to self-isolate because should they become cases, they're not going to have contacts, or at least not many, and will decrease that transmission. So our contact tracers, mostly public health nurses, have been increasingly receiving verbal abuse. They're calling people to inform them that they're cases, they're calling people to inform them that they're contacts, and they're getting yelled at, sworn at. Like, we are all in this together. We have business operators yelling at public health nurses because they're advising them that employees are ill and will need to self-isolate. I don't understand the thought process behind that. Should we have infectious people at your store, putting your patrons at risk? So we can't accept this behavior. You know it's tough. If you're now notified your contact, you have to self-isolate for 14 days. That's difficult. But certainly not the public health nurse's fault. It's the pandemic, and this is our best way to minimize our numbers. So we cannot accept this verbal abuse to our healthcare staff just for doing their job, just for trying to protect Manitobans. You know, we see in Steinbach where that hospital is under a lot of strain. The healthcare workers are working as hard as they can to keep up with demand, and yet on the same day we have a protest, a gathering. Right? We're announcing double-digit deaths every day, and then we're protesting things to try to reduce the impact of the virus, right? How can we reconcile that? Right? This is not that time. This is the time that we need to have a united front against this virus. It's difficult. I know many people, including me, wish we didn't have to do all these things. But we have to right now. We cannot sustain the numbers that we're seeing. We have no choice. We know it's very unsettling to hear these numbers day in and day out, to hear me send condolences to families and loved ones every single day now, double digits. But on that note, we know exactly what to do. We can make that change right now. We can't see these busy stores on the weekends. We can't have people having 85 contacts. We have to minimize that now. And it's tough, right? We're missing celebrations, missing milestones like birthdays. We're telling our kids you can't go out and play with your friends right now. So these are very challenging times, but we can see how challenging it is right now for our healthcare providers on the front line. It has to be very clear, our hospitals are running at capacity now. We can't sustain these numbers. So no matter how difficult it is, we all have to step up now. And it'll have to be together. So thanks again. I know there's lots of Manitobans who have always been stepping up. I know now people will be stepping up even more. Thanks to our healthcare providers at the front line. I know that these next couple weeks are going to be very challenging. But thank you for all your hard work and dedication to Manitobans. And we're all going to step up and try to decrease that demand on your services. So thanks again. I'll pass it to Lanette.
Thank you. Good afternoon, everyone. So the number of COVID-related hospitalizations continues to strain our healthcare system, and it places high demands on our clinical providers. We opened 6 more intensive care beds across the system over the weekend, bringing our overall number to 99. And as of midnight, 90 of those 99 beds are in use, with 46 specifically belonging to COVID patients. 37 of the 83 ventilated patients are COVID positive. I also wanted to provide an update on what's happening at a few of our sites. Specifically, I'll start with Health Sciences Center. I want to say that outbreaks in healthcare facilities are inevitable, expected in a pandemic. They are a challenging but very real reality that we will continue to face over the weeks and months ahead, so long as community transmission remains widespread. To manage these outbreaks, facilities have adopted enhanced infection prevention and control measures. They notify staff and families. They restrict patient movement, including visitors. There's wide testing and monitoring for symptoms and complete contact tracing. Together, these measures help us to lower the risk of infection and control outbreaks in hospitals, but they still occur. They can still occur. And when they do, staff will follow the outlined protocols to contain and limit their spread, and they are supported by occupational health as well as infection prevention and control. Over the weekend, 2 units at HSC confirmed positive COVID-19 cases among their patient populations. Enhanced cleaning and disinfectant protocols are in place. Patients and staff are being swabbed and monitored daily for symptoms, and staff are continuing to wear the appropriate personal protective equipment. This unit, one of the units, will no longer be accepting new admissions for the immediate future. And HSC will continue to monitor this situation closely. Planning is also underway to manage any impact on services and staffing related to these positive cases. And I just wanted to remind all that staff are wearing their universal PPE, which is proving effective when it is worn correctly and also combined with hand washing and physical distancing if possible. Our experts in infection prevention and control and occupational health are currently reviewing our PPE guidelines given the high rate of community spread that we're seeing in the province. At the Grace Hospital, additional ICU space for COVID-positive patients is now being created in what was previously our recovery room space. So equipment and supplies are now being stocked, staff orientation, some of that happened in the spring, but more is happening now to ensure that there is familiarity for those staff who are going to be redeployed from other areas. At Bethesda in Steinbach, the high case counts in the community have put increasing pressure on the staff and have resulted in a number of moves, transfers, and this is part of the site's long-term capacity plan, but they did obviously have to get put into effect this weekend. Surgical activity at the site is now going to be limited to urgent and emergent cases only, so elective cases will stop there temporarily. And this will allow the surgical staff to be redeployed to other areas within the site where additional resources are required. It is worth repeating that while we are able to slow down elective surgeries in order to create space or free up staff to serve COVID, it's not the ideal situation. It is not something that we want to do, and we know that every postponed surgery has an impact to individuals who have to wait longer for their procedure. At Bethesda, a number of staff moves are being made to assist with the site's current needs. So these include rehabilitation staff, working hours on the unit to support patient care. Staff from other acute sites around the area are being offered shifts at Bethesda, and many are volunteering and accepting, so thank you all very much for that. Call has been placed for additional emergency nurses from other regional centers to help out. Additional physician and physician assistant resources have been approved, and this is to expand Bethesda's emergency and inpatient units. Coordination of additional respiratory therapy services is underway, as well as additional support staff such as housekeeping and security. And as well, they are working towards reorganizing the emergency department's waiting room so that there is space for COVID that is separate from the non-COVID patients. Site leadership at Bethesda in Southern Health is in discussions with infection prevention and control to create waiting room red zones to decrease the need to triage patients in their vehicles. So it is a robust plan. It is one that the site and the regional leadership have been working on since the spring, and they've been refining over the past many months. But I do want to be clear, though, that what is happening right now in these sites, in these hospital sites, is really a wake-up call to all Manitobans. The entire system is soon going to be under distress with these high daily case counts, and it really can't continue. The system was not built for that, and everyone's doing as much as they can, but this is becoming more and more distressing every day that we see these high numbers. Over the past 8 months, healthcare workers have worked steadily on the front lines. They have given up their holidays. They have come in on their days off. They have picked up additional shifts, and they have extended their work beyond their regular shifts to help their teams manage the increasing number of patients who are coming in. If they don't do it, there's no one else to do it. So the healthcare workers, we depend on them so much. And if they don't do it, then we can open up more beds. It doesn't matter how many beds and ventilators and space we have. We have to rely on our staff, and they have been amazing. They have been volunteering all weekend to pick up shifts, so I want to thank them. And everyone who's been supporting these moves throughout the system. But our healthcare workers are getting tired. They are feeling stretched, and they're not going to be able to keep this up forever. We have postponed 640 non-urgent and elective surgeries in the past 3 weeks so that we can shift our resources, our people, to handle this surge. The staff are being redeployed to support colleagues in high demand areas. They are training to join new team members, and they are refreshing their skills. We are equipping them as fast as we can to support their colleagues who have been at this for months. And when we saw these numbers go into the triple digits at the end of October, we were preparing for the worst and we were hoping for the best. To see them still in these high numbers is very concerning. It feels overwhelming sometimes for those on the front lines, and we need to make changes now. We need to do it today. There is no plan that can prepare us to manage the demand on our hospitals, that 400 plus cases per day for a sustained period of time is going to create. We need to do better for our clinical providers who are doing everything possible to be there for you. We need to do better for our loved ones, because too many Manitobans have already lost family and friends to COVID, and we need to do all we can to save others from experiencing this pain. And we need to do better for each other. People are dying. Our healthcare system is straining, and our economy is suffering because of COVID. Solving these problems are not difficult. We need to stay home and we need to stay safe. And the sooner we can do that, the better off we are all going to be. I also want to just provide you with a weekly update on the number of positive cases involving healthcare workers. In the past week, 22 healthcare workers have tested positive for COVID-19. 1,600 healthcare workers and first responders have been tested for the virus in the past week. The 22 positive tests include 21 from Winnipeg Regional Health Authority, 1 from Southern Health, and 0 in Northern Health, Prairie Mountain, and Interlake Eastern. Broken down by profession, this past week's numbers include 4 nurses, 16 support staff, and 2 who have yet to be identified. Since the start of the pandemic, 476 healthcare workers and first responders have been tested for COVID-19, have tested positive for COVID-19, and 27,555 tests have been completed since the start of the pandemic. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line that due to scheduling, we'll have to compress today to 1 preliminary and 1 follow-up at this time. Up first this afternoon from the Steinbach Carillon, Josh.
Hi there. So given the severity of the situation in the Steinbach Hospital, how close is healthcare to setting up temporary hospital space in, say, the arena or some other large space in the city?
Yeah, we have made preliminary plans and scoped out space in the spring. We are now continuing those discussions, and they are looking more and more real as these numbers continue. So we will keep you posted on that, but work continues, and we'll be making a decision and an announcement fairly soon, I think, if we don't see these numbers going down.
Okay. And I guess this is for probably Dr. Roussin maybe, but given what we understand about vaccines, and say a vaccine becomes widely available and a lot of people take it as soon as it becomes available, how long might it take for new cases to significantly decrease? Are we talking months or weeks?
Yeah, so a vaccine, I mean, there's some good, some optimistic results with this, but we are still months and months away from looking at any realistic access to a vaccine. And then we are many months to a year away to be able to have enough vaccine to be able to affect, herd immunity. And so it really depends on how much access we have to a safe and effective vaccine and how quickly we could get that administered. So it's good to be optimistic. I think that we're not going to be in this pandemic forever, but we are, 6 months to a year away from any hope of reaching anything nearing a herd immunity.
From CHVN, Taylor.
Hey, good afternoon. Dr. Roussin, why do you think people are still going out, and how do we combat the desire to do that?
I think it's a challenge. I think we're 9 months in, and I think Manitobans stepped up a lot at the beginning, and again, most continue to. But I think it's the nature of how challenging it is, that there's some fatigue out there. But, we don't have a choice. You see these numbers, it's not sustainable. We can see how many deaths we're announcing, the strain on our healthcare system. So we just, we have to change what we do. We have orders in place. We're stepping up enforcement. But, all of these plans require buy-in from Manitobans. And that's what we're desperately seeking right now.
And there's a lot of the thought process of, it's just this one birthday party. I can't let COVID stop my life. What do you have to say about this?
I think that's, we see that at the individual level. We see it right now with business sectors, that it's not my business sector, it's not my gathering I had at my house, etc. The fact is, at the population level, it is. It's all of these things. And so we see spread in multiple sectors. We see spread at multiple type of gatherings. And so we're all responsible. So we all need to step up. Our actions have an effect on so many people around us. We can see that one case with 85 contacts. And if that secondary attack rate is in keeping with what we've seen up to now, we're talking 12 to 14 cases as a result of that. And each of those 12 to 14 probably have household contacts. So our actions have an effect on so many people around us. So we just need to really focus right now on staying home.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, my first question is for you. Do you believe that the retail stores that are allowed to be open right now, places like Costco, Walmart, are places where people are becoming infected with COVID-19? And what epidemiology or evidence do you have to support that either way?
What we know is that this virus is transmitted with prolonged contact indoors. So you can substitute that for any place where you're going to have prolonged contact indoors. And so taking in consideration that when we see widespread community-based transmission, by definition, we're not able to confirm the acquisition on many of these. So what we need to do is reduce the amount that we gather, reduce the amount we go out. And that applies to the stores that you mentioned, that applies to any type of gathering. That's our only way out, is to reduce leaving our household. We should only be going out for essential purposes, send only one family member if possible, do curbside pickup, other methods like that if possible, but it's essential reasons only. And that's our only way forward, is that we have to reduce our overall amount of contacts.
Thanks. And my second question is in regards to Maple's personal care home. I realize that both the province and the WRHA have said that there is no intention of taking over management of Rivera long-term care homes, but we also heard over the weekend that management at the Maple site, they weren't able to report deaths to public health in a timely way due to staffing shortages. So why is Rivera still allowed to operate Maples and other homes when it's demonstrated that it can't keep up with what's required by public health?
I would defer that question to the Winnipeg Regional Health Authority. We are in contact with them. I understand that those reports of the deaths were delayed, and I don't have the specifics on them, but I would suspect and I would support that the staff were focusing more on patient care than paperwork. So although we want everything to be done expedited, we do sometimes have to prioritize. So specifically with regards to the staffing situation, I would defer that to the Winnipeg Regional Health Authority.
From Global, Joe.
Hi there, Joe from Global here. Just wondering, how will you be identifying the businesses that you spoke about with the busy parking lots not following the orders, and what will be done?
Yeah, and so this is going to be really on a move forward basis, that enforcement's going to be out, and there's not going to be tolerance anymore to breaking any of the public health orders. And so it's really that message to, and again, I'm sure the majority of people who are open right now are doing everything they can and need to. But for those that aren't, there's going to be strict enforcement moving forward. We just can't tolerate this any longer.
And some people appear to be, a little frustrated that the language in the order isn't very clear, which allows some of these big box stores to stay open. Has the language changed in there? Because some of these stores were closed in the spring, and now they're open this time. Has the language changed at all, or can you clarify what makes a business essential? And if the numbers don't go down, will you be revisiting the way this is worded and maybe shrink that list of essential businesses?
Yeah, so there's lots in there, and so the wording in the orders hasn't changed much since spring. We based it on the same way. What we found is that there's a number of places now that have found ways to try to be in the critical category by just selling small amounts of something that listed critical, and then therefore stay open outright. And so, yes, we are looking at ways. We're going to be engaging with the sectors to see what we can do to try to minimize that. Because, like I say, we're not looking for ways for Manitobans to be out and about. We're looking for ways to have Manitobans at home for this short period of time. And so, I think it's really important to do that. We may look at revising the orders if necessary to be able to achieve that. The other side of that too is, like I said, is to be successful, we need buy-in from Manitobans. And so, although some of these stores are open, it doesn't mean they need to be busy. Right? We need Manitobans to stay home, not going out shopping for non-essential products right now. So there's both sides. We can't be successful without that buy-in. We can have orders, we can have enforcement, but we need the buy-in to be successful here.
From the Brandon Sun, Michelle.
Yes, hello, good afternoon. My first question has to do with a report from a parent. Their child attends a Brandon school. The child was tested and stayed home for 10 days. But this weekend, the parent received a notification that there was a positive case in the child's grade 3 and 4 cohort, dating back to November 4th. That's an entire incubation period. So the question is, how can we stay ahead of this and keep children safe if those are the timelines? Other readers have expressed similar concerns about their children.
Yeah, so there's a couple issues. I can't speak specifically to that. There's no doubt our goal is that, people who are symptomatic and going for tests are going to self-isolate pending results. And if we do find a positive case that's was infectious during school, then we're going to notify the cohort, and the fastest we can do that, the better. And so we are working on ways to do that. For the most part, our contact tracing has dramatically increased its capacity. We do hear of these type of scenarios, and they could be outliers. And I've mentioned there could be other explanations too for a delay. If there was a delay in testing, if a person was ill, staying at home, and waited quite a bit of time before they were tested, then we search back to when their symptoms started, and then that was where we'll do the contact tracing. So there's lots of explanations for sometimes these outliers, but no doubt we want to be able to identify cases quickly, have them isolated, and very rapidly identify contacts and having them isolate.
Okay, thank you. My second question is also from a reader. Are all hospitals in Prairie Mountain Health Region capable of caring for COVID-19 patients, or are these patients transferred to larger centers? If they're transferred, which hospitals are they transferred to?
Great question. So every hospital is capable of managing a COVID-19 patient. COVID-19 patients can be quite fine on their own at home. It really depends on not so much the label of COVID-19, more so about what is their acute care needs. So if they need more intensive medicine or critical care, then no, not all hospitals are capable of providing that. So it really depends on what there are some very low acuity COVID patients in the hospital who are quite fine to be, as I said, at home or in any hospital. If they do require to be transferred to a critical care or an acute medicine, if they were in Prairie Mountain Health, they would refer to internal medicine or physician most likely, and have that consultation, and then they can determine together where is the best place for the patient to be. So we would consider Brandon being an intermediate hub, and Brandon, our critical care doctors the teams actually meet daily so that they can coordinate who's going where and what are the care needs. So it's kind of individual and dependent on what the patient's needs are, but there's a pathway.
From CJOB, Will.
Good afternoon, everyone. I believe my questions today are best directed to Lanette. Now, understanding that the situation is a bit fluid and things can change, based on the data and information you're working with right now, can you give us a sense of what you're projecting our hospitals may look like in, say, 2 weeks' time?
Well, we are admitting about 3 ICU patients a day. So it really depends on what the trajectory is for them and how long they require critical care stays. So it's probably looking like obviously we're already congested. We've already opened up beds. We expect to keep opening up beds and redeploying staff as the days and weeks go on. Yeah, I think the projections are not looking good. Like if we had a worst case scenario, it feels like this would be it. We want to see these numbers go down and decrease the intensity on our hospitals.
Okay, thank you for that. And kind of following up on that point, you mentioned earlier you've kind of scoped out some places in Steinbach, such as the arena, to expand capacity. I'm just wondering if you can tell us how close we are to that here in Winnipeg.
When I said we scoped out capacity, that would be provincial, not specific to Steinbach. but we are looking at some large areas that can house up to 100, maybe a little bit more people. And that was part of our third stage of capacity planning that we talked about a couple of weeks ago, where it wouldn't necessarily be COVID patients, but it would be low acuity patients. So patients who are in the hospital but are stable, but still need some medical care and aren't quite ready to go home, or the home care is not in place to support them, or the PCH is not accepting. So we're looking at that space, and for sure one of those spaces would be in Winnipeg.
From the Winnipeg Sun, Scott.
Hello, good afternoon to you both. Scott Bills here with the Sun. You both sound exhausted, having to go over this every single day. Can you, and I know you guys have been mindful of not putting fear into the, whatever and that sort of thing, but can you just spell out what the future looks like if this trend keeps up in the province?
Well, I think at this trajectory, if we're seeing these 400 cases per day, then we're going to see that continued admission rate into the ICU, right? 1%, 2%, and that's going to overwhelm the system in very short order. And so we have no choice but to bring these numbers down. We just cannot sustain these levels for the long term. The healthcare system prepared to be able to meet the demand for these type of numbers, but we just don't have the ability to maintain these numbers in the long term. So that's why it's essential. We're at the critical level now. We need to see these numbers come down immediately.
Okay. I guess okay. How far are we away from a full-scale lockdown at this point? And I could have walked into Best Buy this weekend. I don't know why I wouldn't get a TV at this point, but why are we allowed to? Why are these stores still open? And how far? If people still have these options to go, obviously they're still going to do them. So how far are we away from just full-scale lockdown at this point?
Yeah, and I think that this is kind of thing that we were talking about, is that we have to be able to maintain critical goods and services to Manitobans, and make sure there's access to that. But like you said, there's a lot of non-essential things going on right now, and certainly that's not the spirit of those orders. And so we're looking at potentially adjusting those. But enforcement and orders can't be the only plan. Our plan relies on all Manitobans to step up and to contribute, to do their part. And that includes business owners. That includes patrons at these businesses. And so it's just critical that we do this now. And it's just that simple question: do you need to go out? Do you need to go make that purchase, in person? All those, the items you mentioned there, you can purchase those online, you can pick them up at the door. That might not work for everyone, but it's non-essential. So right now we need to focus on essential reasons for leaving our house. Otherwise, we're staying home.
From CBC Manitoba, Bart.
Hi, Dr. Roussin, Ms. Siragusa. Ms. Siragusa, this call-out letter that went out to family doctors who would be willing to work in critical care, how is a week of training sufficient for doctors to provide safe care in an ICU setting?
Well, it depends. It's much like we talk about the models of care for non-physicians, where we need to look at what are their skills and training and background. And based on what they have, what can we train them up on? What can we enhance? And then how do they work in a team-based model?
Okay. Dr. Roussin, it's pretty clear Manitobans are disregarding your public health advice. Manitobans didn't listen in Winnipeg in September when you asked. They didn't listen late in September. They didn't listen in October. They didn't listen earlier this month. They're not listening. Victoria in Australia shut down severely to the point where they did enforce a household-only order. People could only go out for walks with one other person. And now they've had no cases for weeks. Given that you say we're at a critical point, why don't you put in a strict household-only order right now?
Well, it's like I said, our approach can't only be orders, right? When we're talking about having a household order and whether it's right now the group of 5 is what's the enforceable versus the order, we have large protests going on. We have crowded stores. So we need to get the buy-in from people. Even if we put that order in, we can't be everywhere and enforcing everything. So no doubt that there could be more strict orders coming, it's something that we're always looking at. But the success is going to rely on buy-in, because we just can't be everywhere at every time enforcing everyone.
From the Canadian Press, Steve.
It's been 2 weeks since bars and restaurants were forced to close in Winnipeg, and you'd previously said that it was in those types of gatherings where you were seeing a lot of the spread. So given that it's an incubation period is now passed, the numbers are not down, do we know where the spread is happening? Is it happening somewhere other than, bars, restaurants, and even private homes where people gather around a table?
Yeah, well, it's community transmission now. So by definition, it's widespread. We can't pinpoint it. When we saw early on, that's where we saw in that 20 to 29-year-old cohort was the major cases at the beginning of the second wave. We saw a major indication that that spread at that time was linked to restaurants, bars, establishments of that nature. But it's now in the community. So it's all age levels, it's widespread, and so that's why you need now these large-scale measures to just decrease contacts everywhere. Right now, Manitobans, if you develop COVID, your contact list should be no bigger than your household. Really, for most Manitobans, that should be your contact list. Not 85 people.
So where is the spread happening then? Because again, it's been 2 weeks, a full incubation period since the commercial areas where people would congregate for extended periods of time without masks have shut down. And we're still seeing daily numbers come in throughout all age groups, as you said. It's community transmission. But where are the transmission events happening?
Well, by definition, if it's community transmission, we don't know, right? It's so widespread. It's not at certain points. It certainly is in households. We've seen it, acquisition linked to almost any type of setting. But that's why we, right now, our focus is on staying home, because we can't say it's only in this certain establishment where we're seeing transmission. Right, it's widespread. So right now, the only approach to this is everyone to decrease their contacts and to stay home.
From CTV Winnipeg, Michelle.
Hi, I have a follow-up question about the expanding space into potentially hockey rinks. At what point would you open up a facility like that and start moving patients into it?
We would start that soon if the numbers continue as they are, because it will take a few weeks to get organized, but it would be dependent on how many people are being admitted to acute care, how much ability we have to keep expanding the space, and we have to stay ahead of that. So if we see that the space is opening up at a rate which we can't sustain longer term, then we'll have to do that soon. And the space, it's kind of like we've been talking about when we talk about capacity planning. The space, maybe there's potential spaces out there, but it will be, and we have the equipment and the beds, we've prepared for this, but it will be about finding the right staffing models and getting them in place to support that additional capacity. So we're going to have to make the decision fairly soon because these numbers are just, they're coming into the hospital, and we still have space, but we also have to plan for the next level.
Okay. I also have, just one second. So the WRJ has stated some nurses are being reassigned to high priority personal care home sites to help deal with outbreaks. Does the single site staffing model still apply to staff who get reassigned? And what role does shared health play in making sure the site worker is coming, that where they're coming from isn't left short-staffed?
The one-site model that was initiated in the spring, that was put in place from what we learned in other jurisdictions, only applies from PCH to PCH. So, and we have the ability still to move people from acute care into the personal care homes. Like it's just really parallel. If you're going from one personal care home to another, that's not allowed. But you can still be a healthcare worker from another environment and then go support that personal care home. So that's still, that's how they would do that in a priority situation. And what was your second question, Michelle? How does shared health support that?
Or, yeah, what role does shared health play in making sure the site where the worker is coming from isn't left short-staffed?
Right. So really that is, what we've done is we have set up some processes, and we have a HR team that looks at recruitment and redeployment. So we use a little bit of extra recruitment. Sometimes if we can, we'll use volunteers. Sometimes, as you know, with the Red Cross, we can use external resources. And then if we're working from within, which we are, that's part of redeployment, is that the regions themselves have to determine where they can give up resources and how do they support using different staffing models. So right now, if surgery is going down, they might be redeployed in one place. If home care's limiting to certain activities, then they might be redeployed to another place. So it's really about each region looking at their people in their totality and how they make strategic shifts to support short long term.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, first question for you this afternoon. Again, 35 deaths over the last 3 days. One thing we're hearing today is that morgues are running out of space in Winnipeg. We've heard there's a refrigerated truck outside HSC, some planning underway to perhaps utilize arenas for bodies. Can you confirm if this is happening and what the situation is there?
I can confirm that this has been a topic of planning since the spring, and you're right, given the deaths and the high numbers, this work is ongoing. I cannot say that I can't confirm that we're looking at other spaces. I understand there is enough space right now, but it is an ongoing plan that we have to consider.
Thank you for that. Dr. Roussin, when it comes to enhanced orders, can you maybe give us an idea of how that would work? If you go and say, I want to lock down tomorrow, can it happen, or does it have to be approved by the health minister? What is the process exactly for enhanced further restrictions?
Well, if we look at the Public Health Act, Section 67, which is the emergency public health orders, many of the sections there require ministerial assent. And so I think that these are big decisions that impact all Manitobans and impact multiple sectors. And so all of these decisions are discussed with ministers before they're made, but, certainly up to now, public health advice is taken very seriously and followed when we're making decisions about these type of orders.
From the Globe and Mail, Karen.
Oh, hi. Thanks, Dr. Roussin. Can you tell me what the enforcement measures would consist of?
Well, just overall, I mean, I think that there's going to be some more information on enforcement that's taken place up to now, and some further discussion on enforcement going forward. And so I think that's going to be in the near future with it. But it's going to take multiple forms. We've heard of the expanded ability for municipalities to enforce the public health orders now. So it'll be multifaceted, but there is going to be some more information on that coming shortly.
Okay, thank you.
From CKDM, Matt.
Hi, my question could be for either of you. I'm wondering if here in the Prairie Mountain Health Region, we've seen our case numbers relatively low compared to the rest of the province, but obviously over the past few days, we've seen some health districts add cases. Could you reiterate your message to perhaps people that have the attitude of, oh, well, it's not as big of a deal here as the rest of the province?
Yeah, it's very difficult to isolate this virus. So we're seeing numbers go up in all regions here in Manitoba. We're seeing it go up in all areas in Canada and really around the world. We're well within this second wave. And so we can see how quick numbers can escalate. And so even in Prairie Mountain Health, compared to other regions right now, we're not seeing the same numbers, although we're seeing fairly high test positivity that we've gone into orders for in the past. So everyone needs to be aware of this. Everyone right now needs to take very quick action to decrease our amount of contacts. And really, like I say, that means staying home other than leaving for essential reasons.
My follow-up question is regarding the provision of details on care home outbreaks from public health. What is the attitude of public health towards maybe releasing the details about those less severe care home outbreaks? Obviously, we're getting regular updates on Maples and Parkview, but as far as perhaps the smaller outbreaks, what's the province's attitude towards delivering those details?
I do think that we're working on being able to just provide a regular update on all those outbreaks. And of course, depending on circumstances related to privacy or anything, we'll be able to provide those updates. So I think there is something in the works to just have that available online and regularly updated.
From CBC National, Cam.
Hi there. I'll give you guys a choice over who's most appropriate to answer this one. We have heard that hospitals are making decisions right now about what patients to intubate and which to allow to palliative care or die without intubation. Is this happening already?
Well, as far as I know, I would say that there is capacity. I know this weekend we had lots of staff volunteer, and we're so grateful for that. So there is capacity to bring patients in. Every patient has a plan of care, and that conversation happens between physicians. It always has and always will. So to my knowledge, we are still accepting patients. If they need ventilation, we are providing what they need.
And a second question for Dr. Roussin. I understand that your point earlier, you can't restrict your way out of this pandemic, but looking at what we saw on the retail side this weekend, are you entertaining perhaps restrictions or I don't know what the legal avenue for this would be, in restricting what stores can actually sell? To use your example, say being able to go into Canadian Tire and buy something to fix a faucet, but not be able to buy Christmas lights.
So no doubt things have to change. And so we are looking at on that. We can't have a repeat of that this coming weekend. The capacity limits have to be followed. We are looking at ways of further defining just what critical is, just how to define a critical store and critical products. So there's a number of avenues we can take, including the ability to enforce them. And so I think it's safe to say that things aren't going to stay the way they are. We're going to be making changes to ensure that people are stepping up, that we're not seeing crowded businesses, that we're not seeing unnecessary, non-essential, shopping or crowding.
Thank you.
We have time for just one or two more questions this afternoon. Please proceed.
Hi, Dr. Roussin, Bartley Kivas here. Further along Cam's comment, what is your message right now to the big box stores that did no effort whatsoever this past weekend to limit their capacity, limit the people walking in?
So, to anyone who is in that category, I'm certainly not naming anyone and certainly not all of them, but anyone who is disregarding the health of Manitobans you're harming Manitobans, you're harming our effort. The quicker we can get these numbers down, the quicker we can start looking at, loosening restrictions again. The longer we drag this out, we're putting Manitobans' lives at risk. We're putting our healthcare workers at risk. So the time for action is past, but now we need everyone to for sure step up. Do your part. This is about Manitobans' lives.
And in your personal opinion, is IKEA an essential store?
So I'm not going to speak specifically. I speak broadly on what things are critical, and I think that moving forward we have to know both on the operator side, but on Manitoban side, right? Even if this place is open, it doesn't mean it's busy, right? We've said if you walk into some place that's crowded, you shouldn't be in there. We're telling Manitobans only go out for essential things that you need right now. And so we need to work on both sides. We need that buy-in from Manitobans. We need buy-in from operators. Just exactly what we're trying to do here. We're trying to disincentivize people leaving their house, and so we want to step up on that.
Open right now. How can we justify keeping schools open right now if there's this much widespread community transmission?
So we look at, again, the importance, right? We keep critical things open and just how important it is to have the kids in school. So much benefit to families, to children, their education, their development. And we haven't seen a lot of transmission within the schools. So we've seen a lot of cases. And so it's been tested for sure. We see a lot of cases identified within schools, but despite that, we're not seeing a lot of transmission. Now, in saying that, we're always looking, forward to seeing whether we have to make any changes to it. So nothing's ever been off the table. We're going to keep everyone safe, but that's the reason why we haven't made that move at this point.
I have another reader question. The person wrote in, I have heard that if someone tests positive for COVID, they have to wait 14 days and then they're allowed out of quarantine, and that there is no retesting to ensure they are negative before they are cleared. This would be highly concerning if it were true, considering it is well known people can test positive for much more than 14 days. Do you have a comment on that?
Yeah, it's a good question, and it deals with the nature of the test, and then it deals with the evidence. So when we look at the vast majority of people with COVID, 8 days after the symptom onset, the vast majority of them are recovered. They can't transmit the virus anymore. So in Manitoba, we use 10 days if the person does no longer have a fever and the symptoms have improved. The test, the PCR test, doesn't look for viable virus. That test just looks for remnants of virus. So absolutely, if we relied on a negative PCR test before people were lifted off restrictions, most people would be on for a month or more, but they're not infectious. When we compare this to a culture actually trying to grow viable virus, we find that almost no one can grow that virus after 8 days of symptom onset.
Hi, this is
Dr. Roussin.
Just a quick question. I want to be clear. I understand what's happening at the Bethesda Health Center. So what is driving this influx? Is this people who are sick with COVID in the community getting sicker and then coming into the hospital? Is that the main cause of this increase?
I would suspect there is a high positivity rate in that area. So people are coming in sicker with COVID, and as well as the regular things people come into the hospital with on top of it. So there's different dynamics at play here, but it's the high positivity rate in that area. It's the worsening of symptoms that require hospitalization, and it's the regular work that healthcare workers do, all combined.
Dr. Roussin, Joe from Global here. Just to clarify, if we were to see new restrictions, and I know you said we're not going to restrict our way out of this, but if we were to see something new come through, what's at the top of the list? Like, what comes next?
Yeah, I mean, I think it's, it's really the next restrictions would really be in place to do whatever we can to achieve the spirit of these restrictions, right? So what happened on the weekend in many stores isn't what these orders are about. So if we need to clarify these orders to ensure, compliance and the ability to enforce, then that's probably next. The spirit of the orders where we really want to be, we're really compiled in the current orders. But we just need to ensure people aren't finding ways around them, and that Manitobans are really following our advice to stay home as much as possible.
Dr. Roussin, just a quick one here if you got time. It's Jonas from City News. I imagine a lot of folks will be looking at the numbers here since Code Red and say, it's not working, or they'll look at what happened here over this week and say it's not working. Just a message, though, on the process this is going to take.
Yeah, and so because this virus has an incubation period of up to 14 days, restrictions, we're not going to notice them immediately. It's going to take many days, usually a week or more to really notice the impact of the restrictions. And then keep in mind that a virus like this, it typically grows exponentially. And so when we see things are plateauing at a number that we can't sustain, that also suggests that some of these restrictions are stopping that exponential growth that we would have with unchecked spread. So we have to be a bit patient to see the effects of the restrictions, but we can't be at all patient anymore about following public health advice and following those orders.
Thanks, everyone. This concludes today's media briefing.